Let's see some of the other specialized tests. We have this refractive state determination. So here you can understand, like, easily look out for some technical words or for the specific words, because we are not going to comprehend the entire ENT services or the eye services, and that's not the purpose again. So we need to know it, what code should be assigned. So look out for the key words in it, which should match with the medical record and also with the CPT manual. So if you want to do a gonioscopy, that is pretty straightforward, where it is a visualization of the angle of the anterior chamber. And if it is going to be a sensory motor examination, you can report 9260. If we see the codes for visual field examination, the CPT says 92081 and we have 82 and 83. So how we are going to differentiate is, like, you'll have to look out for keywords like, octopus 3 or 7 is 81. Whereas octopus 33 would be an 82. And also if we see 81 is a limited examination, whereas 83 is going to be a kind of a complete examination. So all these things you can differentiate and select the CPT codes. Coming to ophthalmoscopy, here you need to be very careful whether to assign modifiers, whether you should give a right or a left. Now coming back to the visual field examination, the code says unilateral or bilateral, which means you are not supposed to use any modifiers because the code itself says unilateral or bilateral. Coming to ophthalmoscopy, we have initial or subsequent, and next for angiography, dye study, they will inject a dye, like say typically a fluorescent dye is being injected to study the vasculature, the retinal arteries. Is there going to be any diabetic retinopathy, or is there any proliferation of the blood vessels like neovascularization? So in such cases, they'll have to figure out by injecting the dye. Depending on the dye that is being injected, you can report the code. So 92235 is for a fluorescent dye, 92240 is for an Indocyanine green dye, whereas 92242, if the provider is using both, you can report 92242. We have next specialized services like oculo-electromyography. Just break down the words. Oculo meaning eye, myo meaning muscles, electro is like current, right? Graphy is a representation. So now the physician or the provider is going to record the activity of the extraocular muscles. If it's going to be of the eye, it's going to be EOG, electrooculography. Electroretinography would be a 92275. And if the anterior segment is being imaged, is being studied, the anterior segment, from cornea to iris till the level of lens. Posterior to lens becomes the posterior compartment or the posterior segment. So for anterior segment, you can use 92286, and if a fluorescent dye is used, report 92287. We have the contact lens services, lens prescription. So here you should know what is aphakia. As already discussed, aphaco means there is no lens. Absence of phaco means lens. So absence of lens. Aphakia in one eye, aphakia in both eyes, and here the patient has a natural lens. So you need to figure out the codes based on the presence or absence of the lens.